Hi, welcome to The Knock, the Restore First Health podcast, where we talk about advanced mobile health care, healing at home, and helping patients live with more mobility and confidence. Today, we're joined by Dr. Christopher Niemann, Doctor of Physical Therapy with Fox Rehab. Dr. Niemann specializes in helping patients improve mobility safety at home, which really plays a critical role in healing, independence, and overall quality of life. So, Dr. Niemann, thank you so much for being here.
No, Jess, thank you so much. I'm really happy that you gave us the call, and I'm really excited to talk about this topic today.
Yeah, I think so many people have these questions. And so I want to start with something that I came across, which was nearly 70% of patients with chronic wounds are over the age of 65. And limited mobility is one of the biggest reasons that those wounds don't heal. So let's talk about what people can actually do at home, especially when mobility feels limited or overwhelming. So, Dr. Niemann, I'll ask you our first question, which, for someone who has limited mobility, maybe they're mostly chair bound or bed bound. What are some simple, safe movements they can start doing at home to improve circulation and support their healing?
No, thanks. Yeah, it's a great question, and it's a huge part of what we do as clinicians, especially in this setting. Working with older adults in their home. Um, a lot of the times we're going in there and we are seeing these types of folks that are they're either stuck in bed, they're stuck in a wheelchair, they don't quite know where to start, their caregivers don't quite know where to start. Oftentimes, this lack of mobility is lending itself to more serious issues like the development of wounds or the exacerbation of any of their other comorbidities. So, the answer to this question doesn't have to be something super complex because, like you asked, there are a lot of simple things that I feel like most folks are able to do that can make a big impact if they're done the right way and if they're done on a consistent basis. So I think of the folks that I work with that they might be bedbound. Maybe they don't have any movement in their legs, or maybe they have just a little bit of movement in their legs. They're whatever the weakness or the lack of movement. We come out, we assess, we figure out what can you do, what can't you do. For those that do have some movement, I like to start from the bottom and work our way up. Can you move your toes? If you can, and again, a lot of this stuff seems very simple, very elementary, but it can certainly go a long way in somebody's, rehabilitative journey to getting them to achieve whatever their goals might be. So we start at the toes. If you can wiggle your toes, let's start doing that for a little bit. Let's move our way up to the ankles. Can you move your ankles? So just the simple movement of pumping your ankles on a regular basis throughout the day. I try to give them, a set number to do. So, there's something that they can follow on a more regimented, basis, whether it's a set of 10, a set of 20 to be done every hour, every couple of hours. Let's get those ankles pumping. I like to tell them, hey, pretend your big toe is a pen or a pencil, and I want you to write the alphabet out. So that's something, it's going to get the ankle moving in any and all directions that it can. And I challenge anybody to sit there and try to do that, with both of their feet. It's a nice little workout. You really start to feel your lower leg muscles pumping and moving, and that's going to get the blood flowing. That's going to help the circulation, and, be a nice little warm up and precursor for some of the, maybe more larger and more difficult movements. Moving our way up to the knees. Can we do some heel slides? Just sliding your heel up and down the bed, bending your knees up as far as you can, hopefully within a pain-free range of motion, where you're not necessarily setting off any chronic pain, but, you might feel your muscles working, which is sort of like that good pain that we're looking for. And again, giving them a regimented set of reps, at a good schedule that is appropriate for them. Getting up to the hips. Can you keep your legs straight and lift it off the bed? Can you maintain lifting it off the bed and move it left and right? Great. Let's give you some sets and reps to do for that and write something out that's going to work for you, throughout the course of the day. Can you plant both of your feet on the bed and can you bridge your hips up? That's a big one. That's a good precursor to helping a patient learn how to scoot in bed. If they're too far down on the bed, that can help, teach them how to scoot up on the bed. It can help them if a caregiver needs to help them with changing, to assist in that process. And it not only engages their leg muscles, but it also engages their core muscles as well, which plays a huge role in bed mobility, protecting your lower back, oftentimes helping to reduce lower back pain and things like that. Moving along, can you roll in bed? Can you reach, if you're in a hospital bed, can you reach both armrests, or I'm sorry, bed rails that might be on either side of the bed? Let's try to work with that a little bit. What do you have out of your arms? Do we have any, TheraBand or weights that might be available for you to do simple arm curls, chest presses, things of that nature? So there's a whole lot that you can do, especially if you are just in bed and you're not able to get into the wheelchair too often. The caveat to all of this is, every patient is a little bit different. What might be appropriate for one person might not be the most appropriate, for the other one, just based on what their diagnosis is, what their pain levels are. So if people don't know where to start, I encourage them, talk to your care team, talk to your family, talk to your doctor. That's where a therapist coming in can play a huge role for these folks in determining, what specifically is going to work for you and what's going to be fun, what's going to be something that you're actually going to enjoy doing and you're going to want to do on your own on a consistent basis. And what us as
I think
therapists do is try to figure that out
that's
for somebody.
that's the key, right? Like, is getting them to do it. Because I know for me in the past where I've gotten injured and I have my take home physical therapy stuff, like it is so hard to like figure out that routine. And so I just know that so many of our patients, and likewise yours, as well as our caregivers, struggle with finding that thing that makes it easy to remove the barriers of actually doing it. As you were talking, I was sitting there thinking like, wow, I think, if I was in this position, it might work for me to have a checklist of, did I do my feet, my ankles, my hips, my upper body, and then you're just checking that off throughout the day. Or in your experience, have you found that there's like a specific routine that helps with compliance, or like what do you see to make this doable for people?
Yeah, no, that's the magic question there. How do you get these folks to do their homework? How do you get them to carry over all of the things that you're doing as a therapist? And it can be a challenge. I feel very lucky to work at this practice because we work primarily with older adults in their homes and in senior living communities. So the types of therapists we attract are very smart and they're experts at working with people in these settings and helping them to achieve goals within their functional environment. But working with this specific patient population, geriatrics, which 65 and older, oftentimes it's tough to find something that might motivate somebody like that. And, as a therapist, you need to learn how to connect with people on an individual basis, meet them where they're at, figure out what their goals are, and figure out a way to motivate them, to let them know like, hey, you don't need to throw in the towel. We work with
Mhm.
people in their 60s, 70s, 80s, 90s, even over 100 years old that still benefit from our services and are able to regain function that they've lost over the years, whether it's from a
Wow.
particular diagnosis, whether it's from just being sedentary, whether it's just not knowing what they need to do. So, it seems overwhelming for them to even start on some sort of a functional mobility journey. But meeting the patient where they're at, figuring out what interests them, and trying to gear their program around something that, we feel like they're going to be able to do and they're going to want to do. Some people love exercise. You show them what to do, they start to notice that it's helping reduce their pain. They're able to stand up easier. They're not falling as much. That's the motivation there. And they want to keep doing that so they can maintain that. Other people might not be as interested in that. So you need to get creative. There's a plethora of great material on the internet in terms of like visual exercise classes that they can do online where it kind of feels like, they're following along on the screen with what somebody's telling them to do. And there's all sorts of resources for that we can get them set up with. or get the family and the caregivers involved. Sometimes people, they just want a workout buddy. They want somebody that is going to be there to kind of tell them what to do, when to do it, motivate them to continue to push themselves so they actually get benefit out of it. And sometimes that's the conversation is, can we get a caregiver involved? Or better yet, when we have to discharge services because we can't bill through insurance anymore, we offer an ongoing wellness program as well, where we can get them set up with one of our fitness specialists that can continue to come out and work with them, via private pay, and continue that program, that the therapist had set up. So they still have that person coming out that's going to hold them accountable, and make sure they're doing what they're doing, but also keep it light, keep it fun, keep it exciting. It's somebody to, do this difficult thing with. But like I always tell everybody, you're always going to feel so much better after you do it, both physically and mentally as well.
Well, and just to know that there's other people in that 65 plus age group that are seeing those results. I think sometimes it just starts with hope. So, man, I feel like we could talk about this for the next hour, but we're already here at our time. So, Dr. Niemann, thank you so much for sharing your expertise today. Mobility is such a powerful part of healing, and conversations like this truly help families feel more confident to take that first step.
No, thank you so much. It's definitely something I'm very passionate about, and I appreciate you, having us on and, giving us the platform to talk about this. Thank you so much.
Absolutely. I can't wait to continue the conversation offline here. And
Yes.
to everybody listening here, thank you so much for listening to The Knock. We'll see you next time.